and Best Practices, Niagara Region's Open House Experience. It is a pleasure to introduce you to our presenters today. First, we have Catherine Lowes. Catherine is a registered nurse who is currently the school health manager in the Family Health Division of Niagara Region Public Health. Catherine has held many leadership roles for the last several years. Most recently, she was redeployed as a manager supporting the COVID-19 call center for the year. Prior to that, Kathy was the nursing practice specialist for 2 years, and she supported departmental work related to policy development, nursing practice, and documentation onboarding. Kathy has been with the public health since 2005. She was the lead for key departmental initiatives such as the Baby Friendly Initiative and the Parenting Strategy. Before coming to public health, she worked in the hospital sector supporting new families in labor and delivery, pediatrics, and obstetrics. Our next presenter is Tracy Tate. Tracy has been a proud and passionate registered nurse since 1990 and is pleased to have served the citizens of Niagara for her entire career, both in the acute care hospital system as well as long-term care. Currently, her professional focus is on building and fostering leadership and scope of practice in LTC through the, through the BPSO initiative and Senior Services Project Charter at the region of Niagara. She is an active professional mentor, a member of the Niagara District Council of Women, and past president of the RNAO Niagara chapter. So without further ado, Kathy and Tracy, please go ahead.
Well, hello and welcome. Tracy and I both are very excited to be here today to be able to share some of our experiences about working collaboratively in the RNAO on RNAO best practices. I'm going to pass things over to Tracy, and I'm going to let her get started with our presentation.
Thanks, Kathy. Sorry, everyone, I was still on mute. You'd think by now, after Zooming in the pandemic for over a year, I would have the hang of this. Anyways, first of all, I would like to thank the RNAO for inviting Catherine and I to speak with you this afternoon. So this presentation is an overview of our RNAO BPSO open house and talks a little bit about collaboration between public health, long-term care, our community, and the Niagara Health system. And we wanted to put a special thank you out to the representatives who did attend our open house. So that was specifically, of course, our public health nurses, our long-term care homes, also some community long-term care homes, Niagara Health, Brock University, and Niagara College. So our objectives today will be to provide an overview of our best practice work that had been done by Niagara Region Public Health, BPSO, as well as the long-term care homes, BPSO, to understand the activities used to engage our staff members, both at the public health units and our long-term care homes, and an overview of benefits of collaborating between two best practice spotlight organizations. One thing Kathy and I laugh about is neither of us, despite both being employees at the region and being best practice nurses, neither of us knew each other or knew that public health and long-term care were even BPSOs. So we've learned a lot about each other through this project as well. So I'm going to specifically speak a little bit about what best practice has been like at long-term care. So at the region, we have 8 homes. Over our first 3 years, working towards becoming a Spotlight organization, we did implement 6 BPGs, which are listed there on the slide. So we are a multi-site BPSO, and the challenge for us from the beginning was knowledge dissemination and sustainability of practice change. This was to be expected, and likely some of the same barriers with any project anywhere would exist. So the way we chose to tackle our project from the very beginning was by creating site best practice champion teams with the provision of biannual events for champions to come together for knowledge exchange. So again, because we have 8 sites, which spanned from the Grimsby area all the way through to Port Colborne, most staff would not even know each other and would never get to interact. So we felt it was very important to have our champions come together. So in year 1, 3 of our homes focused on person and family-centered care and building and sustaining leadership, with a focus on leadership at the point of care, because we recognized that in long-term care, the vast majority of our staff are PSWs, dietary, and housekeeping, so not registered staff at all. So in year 2, each of the 3 homes took on a different BPG to kind of figure out which practice changes made sense and wanted to be adopted across our organization. In year 3, we disseminated all of our practice changes across all 8 homes. And we did this by disseminating 5 BPGs in 2 days. Although this sounds like a huge undertaking, we had been creating and embedding change in our documentation system. So staff literally were already implementing best practice without actually knowing where the changes originated and that this was a best practice. So when we sent our champion teams to the 8 sites to explain what the project was all about, it was very well received. People were nodding their heads and they actually had light bulb moments so that it made sense for them. So from our experience, building leadership at the point of care and embedding change truly were the keys to sustainability. Over the last year, and despite the pandemic, our homes still have been working on implementation of the Falls order set in collaboration with a different team at the RNAO. So focus has been on the comprehensive fall assessment and embedding this assessment into point-click care, which is our documentation system. It really is a person-focused deep dive into a fall's history, looking at interventions, you know, and kind of looking into the whys of people falling, usually 2 to 3 times in a month. This also comes with some what we call purposeful rounding and looking at the 4 Ps, which are their pain, position, potty, and possessions. It's really just like an hourly rounding kind of focus. So that's what we've been doing over the last year, and that seems to be working well. And I'll talk more about that closer to the end of our presentation today. These are some pictures. Just when we talk about bringing all of our champions together, and I said, you know, across 3 years and across 8 homes, we really made sure that we had big events where everybody could talk about the challenges and the positives with regards to implementing best practices in long-term care. And this one, I think, is your slide, Kathy.
So this is a picture of one of our partners, the Niagara Health system, which is our local hospital system. And they were involved and collaborative in some of the work that we did. So this was just a few pictures that they submitted of some of the work that they, and some of the events that they had to inspire people to be involved in best practice work as well.
So this is a first year snap of our champions from the 3 homes representing nursing, dietary, recreation, housekeeping, laundry, and maintenance. So truly a multidisciplinary team, and we call them the superheroes of change. And honestly, having something as corny as Captain America as our theme really made it kind of fun. So we're all superheroes of change, we said.
Early on, when I first met Tracy and we were sort of talking about some of the events that we had done and ways that we were really trying to engage staff, Tracy had showed me that previous picture. And that was that picture that really solidified that I wanted to work with her. Because I felt like we needed some of that at our facility as well, in our organization. So this is a picture of the RNAO Symposium in 2019. I had the pleasure to attend 2 in-person symposiums before COVID hit. And this was a poster presentation that we did regarding some of our best practice work focused on infant sleep. And it was such a great opportunity really to collaborate with other nurses and to share some of the work that we had done where we had worked with experts, not only within the province, but really across Canada. So it was really nice to be able to highlight that work. And this was about the time that Tracy and I first met and decided that being 2 best practice spotlight organizations working under the umbrella of Niagara Region, there just seemed to be some opportunity for us to share some of the wins that we had. So at this symposium, which was really great, is Tracy was there able to present and to celebrate some of her best practice work. And you can see there's a picture of her there presenting.
So thanks. That was really an amazing symposium. The RNAO did an amazing job of keeping everybody engaged. And we as an organization in long-term care homes, were so fortunate to receive our designation for all 8 homes. Originally, we had, when we did our RFP, we had only proposed that 3 sites would seek BPSO designation. However, by the end of 3 years and with a lot of assistance with our coach, Deidre Boyle, we were able to prove that we had disseminated best practices across all of our sites and received the designation for all 8 homes, which was absolutely amazing and brought me to tears.
So a couple of the following slides are slides and we're going to show you some pictures of an open house that we had. But one of the things that Tracy and I think both felt were really important in our BPSO journey was around making sure that staff are really engaged. So when we had our open house, this was one of the slides that we used just to encourage individuals to find out a little bit more about becoming a best practice champion. And there's a picture of Tracy and I with Doris there at the bottom. So it was, just a way sort of to start conversation. We had the bones of this presentation that we're doing for you today sort of ongoing through a PowerPoint that was timed so that, every now and then people would glance up and there'd be a PowerPoint slide up there that we would have some conversation about. This is a similar slide. At the open house, we wanted to really entice individuals across the department and corporation, as well as our invited guests, to become involved in best practice work. So our slides in the morning captured not only educational opportunities, but a bit about the process that our organizations use to ensure that best practices were recognized, shared, implemented, and obviously the key part to this, making sure that they were sustainable. This was one of the ways that we communicated this by having this up on our PowerPoint presentation. And this was a slide that just gave a little bit of background about the public health work that we were doing. We have been a best practice spotlight organization from very early on. And there's been numerous managers and nursing practice specialists that have been sort of tasked with keeping up our designation. We have 5 sites that coordinate all of this work. And when we did this presentation, and when we submitted this presentation, actually, Brittany Thompson was our nursing practice specialist, but since then, we now have a different nursing practice specialist, Stephen Shears, who some of you may meet in some upcoming RNAO events. But yeah, so this was one of the slides that we showed as well.
And likewise, this is one of the slides that I'm getting a lot of feedback here. Sorry. This was one of the slides that we showed about our long-term care homes. I was the liaison for the first 3 years until we were designated. It's now our nursing practice manager, Laura Matthews, and our documentation, Ronna Perrin, who run most of the BPSO work now.
So when I was in the role of nursing practice specialist, this is a picture of the committee, and I was in that role until COVID hit. We really had sort of 2 groups. We had a nursing professional advocacy group that was made up of middle and senior management that really were the ones that facilitated a lot of the change that happened. And our nursing practice development committee was made up of nurses and actually became sort of multidisciplinary as time went on. Made up of different staff members from different programs that sort of became the eyes and the ears of the program and could identify the needs of the program and often identified what best practices needed to be considered. And then we would roll those recommendations up into the nursing practice advisory group, and they would make the decisions about which interventions or strategies that we could move forward. And that's a picture of our group with the best practice guideline we were working on at the time. We have had a few advanced clinical practice fellows in public health over the last few years, and these are a few of them. Niagara Health, who also came to our open house day as well, was invited to share some information about the fellowship that they were involved in, and so we put some information up regarding that as well onto the slides. And this is our latest fellowship that was just completed during COVID last summer in 2020. Brittany Thompson, as mentioned in one of the previous slides, was our nursing practice specialist, and she did her fellowship on building capacity in public health nurses for health promotion. Health promotion in public health has sort of been a hot topic around health promoters that we employ, as well as what is the role of public health nurses. So she had these 3 sort of objectives for her fellowship, was around, learning goals and increasing knowledge to understand health promotion capacity building interventions for nursing in a public health setting. She did a rapid review following the evidence-informed public health model that was conducted, and the evidence was translated into actionable recommendations. I think she came up with 9 recommendations and determined the specific models, theories, and frameworks necessary to underpin capacity building interventions, as well as contextualize factors that optimize their effectiveness. So we haven't really had the chance to roll this out because of COVID, but we're really hoping to implement some of the ideas that came from Brittany during her time doing this fellowship. And these are a couple of pictures that really make me smile. This is when Heather McConnell came to Niagara when I was the nursing practice specialist. I really felt that I was sort of struggling to get from point A of identifying the best practice guideline we're going to work on and how to really implement it. So she came and spent time with our nursing practice development committee and helped us with some exercises that kind of assisted us to become unstuck where we were. And we had a lot of fun doing it. And it was such a very, very valuable day. I hope that we eventually get back to the point where we're able to do these in-person meetings and to have support in this in-person way, because it was just such a special day and so incredibly helpful. And from that meeting, after that meeting, these are the 2 BPS or the 2 BPGs that we were able to roll out and really get some traction with. So we were really proud of the work that we were able to do that year.
And this, as I said earlier, preventing falls and reducing injuries from falls was something that we were really wanting to work on. Early on in 2020, our organization recognized that our quality indicator for falls required some work right across all 8 LTC home sites. We were quite concerned that the province was looking to shift funding to a model of more of a pay performance, and our Sea of Red scorecard, as we call it, had us concerned that in future we would really have to, we would really notice some fiscal impacts if we shifted to that pay for performance model. Of course, the resident experience is also at the forefront of our minds, and I'm sure that everyone recognizes that falls for our elderly cohort can be extremely life-altering. So despite the pandemic, we agreed that the implementation of the falls order set in collaboration with the RNAO was a project that we really wanted to maintain at the forefront of our business. The order set is a comprehensive assessment whereby we do a deep dive into falls, history, intervention, strategies, medication regimes in conjunction with pharmacy, and we look at medical diagnoses. Some homes have added some falls huddles. Most of us are using purposeful rounding, and all have embedded assessments into the documentation system. We continue to work around policy development as we navigate through this implementation, which has been a little bit slower just because of competing priorities. It's a quality focus, though, that is truly multidisciplined and requires a full team input. So I know at my home in particular, at the Woodlands of Sunset, we meet monthly, and our physio team is with us, nursing, pharmacy, and our physician. And we really look at everybody who's kind of been a frequent faller. We continue to struggle with our provincial benchmark in most homes. However, we do understand that it takes time to come to fruition, and we do remain committed to positive outcomes for our residents. And interestingly, you know, despite, as I said, you know, COVID has been huge in the life of a resident. However, we've really noticed that the periods of isolation due to potential COVID symptoms, you know, whereby we've been putting people into 14-day isolation, has really been impactful on our residents, making them a little bit more inclined to fall because they really are isolated and are trying to do things for themselves. So we've been you know, quite concerned about that, and we've been trying to mitigate that risk by, you know, one-to-one staffing when we can do that. And this was our RNAO open house event that Catherine and I, you know, really wanted to showcase. And you can see quite, there's not actually a ton of people there at this point, but again, we had the Niagara College, Brock University, we had the John Noble House. Home came from Brantford and had an information booth, as well as many people across public health. And you can see when their pain management in the vaccine program, as well as our long-term care homes.
It was really just the greatest event for sharing.
Mm-hmm.
And these are just pictures too of different programs within public health that have all unrolled some BPG work and gave examples of some of the things that they were doing.
So you can see the backs of everybody looking at a wall, and if you were closer to that wall, you could see that those pictures are all best practice guidelines. The cover pages from best practice guidelines. So one of the little things that we thought would be fun, we had different colored dots. If you were from public health, you had one color, long-term care and the hospital all had different colors. And we invited attendees to put a dot on the best practice guideline, up to 3 guidelines that they thought would be important to them and apropos to their professional practice as something they would like to focus on in the future. And that list is just a list of votes for what the, I think those are yours, right, Catherine? The public
They
health.
are. And it was interesting, I'm getting feedback as well. It is interesting that the best practice guidelines that sort of had the most interest were things that were really on our radar. So it was nice that staff, identified that these were things that they would like to be seen as addressed in the future. It was a great exercise, actually.
And then those are, I think, those are ours from LongTerm Care. One of the things that we thought was totally amazing, embracing cultural diversity in healthcare, that the Niagara region as a whole also had an employee satisfaction survey, an engagement survey, and that was one of the top components that pretty much everybody recognized as something that would be important to them for an organization to address. And so that really came across strong as well, that the homes wanted us to look at that as far as implementation as well. Just proved we were on the right track, I guess. And these were the votes from the Niagara Health system. These are, again, just some more pictures of our booths and our friends on the top left from the John Noble home. We were so thrilled to have them come. And this was just a thank you to everybody who joined and everybody who's on the call today. Thank you very much for listening to our stories. We did have a lot of fun. Catherine and I laughed because you can always get people out to food. So we did have some great food. We made it a really fun event, interactive, and we even had some swag to give away. So it was really fantastic.
Thank you very much, and Tracy, for that amazing presentation. And Arlene, I'm not quite sure if you can hear us.
Yes, I can.
Okay, perfect.
So thank you very much, Kathy and Tracy, for your excellent presentation. Your narratives and then the photos that you've shown really show your commitment as well as your passion for collaborative practice. And this has led you to your successful implementations. You showed how you increased your network within your region as well. So you also exemplify the ability to overcome barriers and challenges in spite of distance and multiple departments. And that is very commendable. You're superheroes of change. I love that picture. Shows interdisciplinary involvement. So I think at this point, we will now take some time for questions. So as a reminder for everyone, if you can please type your comments and questions for Kathy and Tracy in the chat box. And while we are waiting for the questions coming from our participants, I was just wondering. So Kathy and Tracy, for your staff, what strategies would you say were the most effective in encouraging them to step up and want to be involved in RNAO best practice work at your organizations?
Well, I certainly think from my experience in public health, I think the things that really encouraged staff to be involved was making sure that we were very visible with the work that we were doing. So making sure that we had champions that would go back and would report back to teams and keep the teams involved. We really tried to be as celebratory as possible. Like I said, when I saw Tracy's picture there of her superheroes, I just thought that was so fun and so great and a great way to celebrate the work that's been done. I think as nurses, we do a lot of work that we don't often celebrate. So it's a great opportunity, and I think it helps keep people really engaged when they see some people involved in those celebrations. And then the other thing too is just to remind people that the work that we're doing that's related to best practices doesn't have to be gigantic work. It can be, you know, small pieces of work that just are incorporated into your everyday activities. And I think that Tracy commented on one of the slides that, you know, some of these best practices were in place before they were formally recognized. And I think it's a great reminder to let people know that, you know, this isn't adding extra work to your plate. What we're asking you to do is be part of this so that we can be really intentional about the things that we prioritize and the work that we do, and to ensure that, you know, we are evidence-based and doing all the things that nurses need to do to keep their clients safe and healthy.
Agreed, Catherine. And if there's one thing I can say too is, you know, being part of a long-term care home, you know, we know our audience. And one of my worries early on was when staff saw RNAO and they'd focus on the Registered Nursing Association component, and I was afraid that they would feel perhaps that, well, you know, I'm not a registered nurse, so therefore I'm not part of this. So really for me, in utilizing the leadership at the point of care toolkit, which is actually part of the RNAO, using that, it's a tiny little flyer that I used, and I just used that to show PSWs and dietary and housekeeping that you are part of this project. You're part of the lives of our residents. Everything you say, translates back into resident care. So absolutely 100%, you are part of this, despite it being an RNAO titled project. So that right from the beginning just got people on board, and of course, giving a cape made it even more fun. So I think that was the most important part early on.
That's excellent. So, if you could give one piece of advice about collaborating with another organization on best practice work, what would that be? And what future work do you see yourself collaborating in or on?
I think that when it comes to collaborating, I think the biggest thing is just, stepping out of your work that you're in and looking around to see who else is doing something that's similar to what you're doing, to see how you can really benefit each other. Like COVID hit, and it really stopped a lot of our collaborative work in its tracks because we're just so busy dealing with the actual virus itself. But I am really hopeful that, for future work that Tracy and I, or the new nursing practice specialists will be able to look at, the kinds of tools and things that have been developed, and to be able to collaborate more so moving forward, so that there's not so much work in individual areas, but some of that can be combined. And there's always so much benefit too with just double the brain power and creative ideas and bouncing things off of each other. I've really, really felt a lot of gratitude to have the relationship with Tracy over the last year while we were collaborating on the open house, just to bring some of the ideas that she had into what we were doing and to make it such a successful partnership.
Agreed. And even beyond that as well, having been through the first 3 years of becoming a BPSO, the knowledge exchange component of the program, whereby you're on a teleconference once a month and you start to know people in other organizations across the province, and you start to hear what they're doing. And just as Catherine said, there's a lot of great work out there, and you don't need to redo the wheel and build things from the ground up. It's great to have conversations outside of your organization and tap into what other people are doing, and not be afraid to ask for help, or just have a chat about something. So I think that, that it's been a great partnership with Catherine and I, and then also just with other organizations that I've met through becoming a BPSO.
So true. Among the BPGs that you implemented, because you implemented quite a bit, is there one that you would say is closest to your heart?
For in public health and for the experience that I had, I think the best practice guideline that was closest to my heart recently was really around implementing oh gosh, now I'm gonna really butcher probably the title, but it was around the smoking cessation and just the outreach that we had when we implemented that across the whole department. It was great because it really helped us to, again, to break down some silos, to get to know individuals within other programs, and to really see that work come forward was really rewarding.
And for me, I think person and family centered care, it was the first one we did, but it is the basis for everything we do, right? We live and breathe long-term care. We're here for our residents. We came up with a tagline, nothing about me without me. And we still use that to this very day. We're going through the accreditation process in December this year. And our staff still, after, almost 5 years, still will remember nothing about me without me, and bring everything we do from the top down. Every decision we make is about our residents and our families. And to me, that just proves it's a true community spirit in the homes and in Niagara.
Thank you for sharing that. That is really something. I just wanted to mention, so in one of the pictures, you had Brock University and Niagara College in your slide. Did you have any student participation?
We did have some students through Niagara Region Public Health. We had students that were in some placements that certainly have been involved in our best practice work. And the collaborative piece between Brock University and Niagara College for us, for public health, really too, is that we have and were previously really trying to integrate some of the work that we were doing in public health into some of the work that was being done with nursing students. And so we had connects with some of the professors and some of the chairs of those programs in order to make sure that when students came into public health, that they were well prepared. And one of the things we often would say to them is, coming into public health, it's really beneficial for you to do the RNAO best practice champion work, because we find that really important. And especially if you're coming in at the end of your student experience and would like to be considered for full-time employment, it's a great thing to have on your resume. So we've created some partnerships there and sort of helping students get prepared if they would like to come into public health, and RNAO BPTs is part of that.
That's fantastic. Same here. We, of course, the bulk of our student population would be RPNs and PSWs, but we always maintain that, if you're a student in our home, you're with us in everything we do. So we have historically always included them, even if they weren't with us long enough to have complete champions training. They certainly would, we'd engage them in the project work that we were doing at the time of their placement.
That's such a welcoming way to have students. Niagara Region Public Health has been a BPSO designate since 2012, and Niagara Region Long-Term Care Homes has been a BPSO designate since 2019. What do you think is your formula for sustaining your drive to continue as a BPSO?
I think for public health, one of the biggest things is, I think that maintaining our designation sort of as a spotlight organization gives us a reason to be very intentional about ensuring that we are implementing best practice and evidence-based practice. I think that we go along often and we do things that we've been doing for a while, and the intention of being able to review the strategies and interventions that we're involved in, because our redesignation is coming up, is a great reason to look and make sure that we still are actually doing things that are best practices, are going to be in the best interest of our clients. So yeah, that's sort of from the public health perspective of what it's been so beneficial for us to continue with our designation.
And from the long-term care side of things, I talked a little bit about our scorecard, our quality indicator scorecard, that was a sea of red. So, we're very mindful of that. And, we are all 8 homes in one organization, but even between the 8 homes, we tend to be somewhat competitive. And that is definitely in air quotes, because we tend to be very competitive, because the bulk of us as administrators are registered nurses. So, we are really focused on resident care and outcomes. So, we are committed to quality. And as we shift our practice towards really focusing and drilling down on all of our core programs, we're looking at, okay, what could the next change item be? So again, last year we implemented falls. We're already looking for the next order set. And I know Doris has reached out to our team at the region to ask, would we consider implementing 2 more order sets this year? So there's still big things to come, and we continue to be committed to our residents. So definitely, it's just something that we need to do because it's the right thing to do.
Thank you so much for that. Grace, is there anything in the chat?
I don't see any other questions, but just wanted to really thank Catherine and Tracy for the wonderful presentation and also your answers to the questions. It's quite evident that you're very passionate and you're very proud of the work that you and the staff are doing in order to be able to, sustain and be able to implement best practices and ultimately for the communities and the patients and the families that you serve. And there's a real commitment to partnership and collaboration, and to do it in a way where there is that feedback loop into the PDSA cycle. So it's not tokenistic, but you're really taking into consideration, what do the community members want? What is it that the staff members are needing, and really being able to incorporate that into your implementation plan. So I applaud you for, seeking out the partnership, being able to learn from each other, and being able to continue with your sustainability and, as a collective. And I love your creative ideas. That DOT activity, I think, is something I'm going to take away, one of the takeaways. And the idea of using themes, we just talked about that actually at a cohort 7 launch meeting, and how that makes change management relatable. And if you're able to speak in a certain way that is able to be relatable to staff, and just having fun with change management. And it's obvious that you're very focused on being able to make that experience a rich one. So just want to thank the both of you very much for your presentation. I really enjoyed it. Arlene, I'll pass it on to you to close.
Thanks, Grace. So really great strategy on having a wall of BPGs and representatives from different areas of care voting on what best practice guidelines to do next. So again, our heartfelt gratitude to you, Kathy and Tracy, for sharing your initiatives in Niagara. It is very inspiring to hear the many ways that you are encouraging your staff to participate in best practice initiatives. So, well, time just flew and our webinar is coming to a close. Thank you everyone for being here and for taking time out from your day to take part in this webinar. You will soon receive a link to an online survey to evaluate today's presentation. Please let us know of any suggested topics you would like us to work on. And immediately after you have done the evaluation, you will receive your certificate of attendance. Again, thank you, Kathy and Tracy, for sharing. And for everyone who has joined us today, thank you so much. And on behalf of RNAO, Grace, Andrea, and I wish you all a very amazing afternoon. Bye, everybody.
Thank you.
Thank you for having us.
You're welcome. Our pleasure. And take care, everyone. Have a great afternoon.